Welcome to this short presentation about Sale Databank and how we're making a difference during the COVID-19 pandemic. So what is Sale Databank? Well, containing billions of person-based records, Sale Databank is a rich and trusted population data resource. It improves lives by providing researchers with secure, linkable and anonymised data that can be accessed and analysed from anywhere in the world. And what are the key characteristics of Sale that mean we're able to make that difference? As a safe and trusted databank, we're able to harness data on a population scale to answer important research questions. Outcomes of using our rich data lead to better policy making and improvements in people's lives. As part of the population data science team, we work collaboratively with many different organisations. We provide researchers with linkable, anonymous or de-identified data that can be accessed from anywhere in the world. And we recognise the value of public involvement and engagement in everything we do. Sale Databank is an important tool in our nation's response to the pandemic because we can monitor a very wide range of exposures and outcomes on an entire population anonymously. We have the ability to do this across individuals, households, care homes, schools, and by doing this we can also evaluate the efficacy of treatments across the population. So what are the key competencies that enable Sale to do this? Well, it's our speed and agility to turn data requests around within 48 hours, and to do this during a period when the team are receiving as many requests in a COVID week as they would more typically see in a normal month. It's the richness of our data. Sale is the chosen environment to host the Zoe COVID-19 Symptom Study app, which contains COVID-specific data from over 4 million users. And it's the strong collaborative relationships we have with a multitude of partners. And it's because of this that Sale Databank is enabling COVID-related research across the following areas: government and emergency response planning, impact assessments on mental health, clinical trials comparing treatments, investigations into the link between COVID and ethnicity, linking data to testing programs, and evaluating the impacts felt by society's most vulnerable groups. And across the 4 UK nations, Sale Databank is said to be leading the way across all dimensions, highlighting the benefits of having mature infrastructure in place from the outset.
We formed the One Wales collaboration, which has brought together organisations and groups across Wales, including Public Health Wales, Welsh Government, NHS Wales Informatics Service and many other academic, NHS, policy and public groups. By bringing all these groups and people together, we have helped coordinate the requirements and response from Wales, wishing to use population scale data in order to provide access and intelligence to the right people in an efficient and secure way in order to tackle COVID-19 in Wales and across the UK. Being able to draw upon the world-leading processes, policies and foundations that the Sale Databank has established over the last 12 years has really benefited Wales and the One Wales collaboration. Our existing technology, governance and public trust has really aided us when it comes to acquiring, holding and providing access to data. But also when we have needed to have conversations related to new opportunities and challenges we have faced with COVID-19, we have been able to draw upon our relationships, networks and contacts as well as new ones over time to help us. So by offering them the opportunity to use the Sale Databank, we enable them to do this at a fast-paced but in a secure and responsibly governed way. One challenge we have faced is that the majority of the staff within the population data science teams are funded to work on fixed-term research or development priorities at any given time. We have had to redirect their focus with the blessing of their funders in order to collaborate and prioritise requests and requirements needed by the One Wales collaboration which have been identified over time. The teams at Swansea have aimed to be flexible and pivot to requirements in order to deal with an increased volume and speed of requests for intelligence, but with the response times needing to be reduced as answers and outcomes are needed as soon as possible in order to make a difference. We've also had to learn to use and facilitate access to an ever-increasing array and refresh rate of data sources, which are needed in combination with each other in order to produce outcomes that will allow decision makers to draw more informed conclusions. We have on the whole avoided taking annual leave, and many people are working for more hours than they are contracted to during the pandemic, but we are extremely proud to be part of this and have done so voluntarily with the backing of a strong support system to ensure our team's physical and mental health.
Wales is a small, connected country, and our ability to link data anonymously means we should get even greater value out of that. Now, I expect that we'll share the learning and the knowledge that comes from that with counterparts within the UK and further afield, but that is a positive advantage of our SAIL anonymous data bank that we have to link up different records and what that means for the spread of coronavirus, but also the rate at which people are recovering.